Hey y'all, my name is Jayla and I am the face behind Free-Minded Nursing, where I'm all about holistic health, wellness, nursing education as a whole, and patient advocacy as well. So I wanted to kind of come to you guys, starting out with the first video. Pretty much what I'm going to be doing is all nursing content. So I'm going to be going over specialties, and I also have it's a paper to remind me. My friend got me this book when I graduated nursing school. I love it. I'm so happy to be able to use it. So the first video, I am going to be reading from my quick study. These were critical for me during school. I also have one that goes over nursing pharmacology. I think I had another one, but I gave it to somebody that went over something else. But these quick studies, just what it sounds like, it will give you nursing in a nutshell, which goes over, like, it breaks down the body systems. So it goes over GI, respiratory, cardiovascular, neuro, goes over different EKG patterns, different pressure injury stages, injection sites. I'm looking, y'all, I think I just got a package. I actually just got a nebulizer for my son off TikTok shop that I want to try, because currently today is November 13th, 2025, and this is prime flu season. October, November is flu season, and also, you know, the flu can come in around any time of the year, but this is like the prime time that, especially the little babies, the children's be getting hit with the flu, the children's, the elderly, and the immunocompromised. So also remember January, the cold months, RSV, pneumonia, major respiratory disorders during those cold months. So this is the beginning. So I was just looking out the window seeing my nebulizer come in. But anywho, today, just looking over my pamphlet, I think what I'm going to go over, I'm gonna start simple. You know, I'm gonna start with the nursing process, ADPIE. So with ADPIE, that's the easiest way to remember, is assessment, diagnosis. They do kind of use diagnosis and analyzing back and forth, like, interchangeably, but most nursing programs do assessment, diagnosis, planning, implementation, and evaluation. So with the nursing process, what you're going to be looking over, so the assessment piece is the process by which, excuse me, the nurse investigates the physical, psychosocial, and spiritual needs of a patient through collection of subjective and objective data. So with that, your assessment piece, you're going to be asking, you know, how have you been feeling lately? How has that been affecting your work? For instance, how have you been sleeping lately is a great assessment question to ask, because if someone hasn't been sleeping, sleep affects everything when it comes to your body. If you aren't sleeping properly, your body is not able to reset and heal through sleep. Now, when I was in nursing school, I worked full time. I'm also a single mother. Excuse me. So I had to sacrifice sleep to be able to get the end goal of my nursing degree. But I knew that I was sacrificing a key physiological function such as sleep. But that's just a quick question. Also, this video isn't going to be too long. So I'm going to go over a brief overview of each part of ADPIE, and then I'll probably make another video later on, just going over more in depth, just to be able to get our feet wet with this, with what we need, right? So we have assessment. So diagnoses, that's the data that's collected during the assessment phase to be evaluated to determine a plan of care, right? So you're gonna basically develop a plan of care, piggybacking off what key issues is someone having. So say, I'm gonna just use sleep is the easy one for me to reflect off of. So say they're having issues with getting a consistent night's sleep. If you're not sleeping, that's gonna follow, you're gonna be fatigued during the day. So when you're sleeping, are you able to fall asleep and you're waking up throughout your sleep? Are you catching your breath when you wake up? Like, are you like snoring and you're waking up? If so, my nursing logic, one thing that will pop out to me is, okay, does this person have sleep apnea? If you're snoring and like the tongue is falling back to the back of the throat and blocking off those passages to be able to get oxygen, your brain is going to try to save itself. So it's going to, oh, time to get up, make sure we can survive through this night. So my nursing diagnoses, which a nursing diagnosis is different from a medical diagnosis. A nursing diagnosis is going to be more like kind of like simple, like it's going to be like, which that goes into your NANDAs as well, which goes into care planning. Everything that you're learning in nursing school piggybacks off the next. So during your foundation of nursing, you're going to be learning about care planning and NANDAs, which is your nursing diagnosis, which something like a nursing diagnosis that could go into sleep apnea could be like ineffective airway clearance, right? Your airway is not clearing itself, so thus ineffective. But what maybe the medical diagnosis of that would be sleep apnea. Yeah, so your NANDA is going to expand. It's typically a 3-part NANDA, so it'd be like ineffective airway clearance as related to like if it was something like mucus. Like say you've been sick recently and like your nasal passages are swollen. And so it could be related to mucus or swollen lymph nodes, something that you can see that is objective. Going back to that assessment that can be observed. So related to mucus as evidenced by something like wheezing or a decreased oxygenation saturation. So if your oxygenation is below 92, which is typically the standard that they like it above, if it's 90, if you have something like COPD, 88, 89, that's okay for you. That's your normal. So that would be a NANDA. So that goes into your diagnosis. Going into the next stage of ADPIE, which would be planning, you're going to compose a care plan, which includes your nursing interventions and expected outcomes. Okay, that's where you get into SMART goals. That's going to be short-term, long-term. So a goal will be patient will experience or patient will maintain oxygenation at 95% room air. Say, for instance, if you're speaking like in a clinical sense, like say you're creating a care plan for clinicals, it'll be like patient will maintain an oxygen saturation at 95% during the duration of my shift. That's a short term. A long term, and also don't forget that you need to include your nursing interventions of how you're going to get to that point. So that's your objectives, that's your expected outcome, short term, long term. Patient will, honestly, an outcome could be patient will wear their CPAP, or patient will verbalize understanding of the importance of wearing their CPAP machine at night within the end of the week or prior to discharge. That was one of my favorites to put into my care plan, was prior to discharge. A short-term goal could be by the end of my shift, within 30 minutes, like you're talking about pain medications, it can be they will experience decreased discomfort, or if their pain level is 7 out of 10, they will experience a pain level of 3 out of 10 or less by the end of my shift or within an hour, because it typically takes PO meds about an hour's work. So that could be a short-term goal. Long-term goal could be upon discharge. If you're thinking about working somewhere like case management, you could be like within a week, within 2 weeks, within 3 weeks. But typically in your school assignments, most of your long-term goals are going to be upon discharge. That goes into like SMART goals. Like I said a couple minutes ago, SMART goals are specific, measurable, achievable, realistic, and time-bound goals. What is realistic and specific to your patient, and what time are you looking to achieve that goal? Okay, so ADPIE implementation. The interventions that you plan, how are you planning on like carrying out those interventions? Are you planning on giving pain medications? Are you planning on applying oxygen to your patient? One thing that you could do to stay in that sleep apnea realm, you could lift the head of the bed. Patient, when you're thinking of discharge planning, which sometimes in acute care, you don't think of discharge planning, sometimes especially when you're first getting that patient, but discharge for a patient starts upon admission. So you're planning to discharge that patient when they're admitted. You don't want them staying in the hospital. You don't want them staying in that room. You want to be able to progress them. It's all about progression. So you could teach them, elevate the head of their bed, the hospital bed at 30 degrees. Another way is to put pillows behind their back. Another assessment question that you can ask is, how many pillows do you sleep with at night? Do you sleep with one? Do you sleep with two? If they sleep with one, tell them try sleeping with two. If they sleep with two, let's go to three. Or do you sleep better in a recliner chair or on the couch than you do in your bed? For the elderly population, you will actually find a lot of them sleep in a chair over the bed, and they get more sound sleep in a chair than in the bed due to blockages and respiratory issues like sleep apnea. So that's your patient education. Another example of implementation would be wound care. You're going to educate your patient. You're going to encourage mobility. That's examples of implementation. And last but not least, getting to our E in ADPIE is evaluation, where you're going to sit with your patient and yourself, and you're going to ask, did my implementations of my, interventions work? Did adding another pillow work? Were they still snoring? Were they still waking up out of their sleep to catch their breath? Has the patient improved? Has the oxygenation came up? Has it improved for them? Has their quality of sleep gotten better? Are they feeling less fatigued during the day? Daytime fatigue. And do we need to change this plan if it's not working? So that's going to be your evaluation. You're going to come back, and this goes all into care planning. When you're actually in practice, you're going to see that care planning is a interdisciplinary effort. You're going to have care plan meetings with the social worker. You're going to have care plan meetings with the doctor. It's going to be like a table of people where you're meeting with different people, seeing how each other are coming together for the benefit of the patient. And that can be social work, the medical doctor, the nurse that is caring for the patient. That may be the nurse who cared for them last week. That may be the nurse you're caring for them today. And case management and the patient. And if the patient doesn't quite understand what's going on, that can be someone, their medical power of attorney, or it can be a parent, a close friend, someone that can explain to them what's happening, to ensure that they're getting the care that they deserve, and make sure that they're being properly cared for in the facility and at home, or a patient advocate, something of that nature. So that is ADPIE in a quick nutshell. Like I said, I wanted to go ahead and get this video out for you guys, because I remember how important it is to know this information, because this is your license. This is you and what you're trying to do. And I definitely look forward to seeing you guys more with all the videos that I plan on putting out. I definitely have several series that I'm going to be putting out in this upcoming year. You guys will be seeing a lot more of my face. So I hope you like it. I hope you like the content. Like and subscribe. Please also share with your fellow nursing students, with your fellow nurses, because even though we get this license, we still have to keep practicing, because nursing changes every day. Medicine changes every day, and you have to stay in practice in order to ensure patient safety. So it's nice talking to you guys. Until next time, be blessed and care for your patients well.